UVB causes sunburns and rarely it causes skin cancer in Indians. Even on a cloudy day, 80% of these ultraviolet rays penetrate the clouds and reaches. When we are inside, indoors, there is tube lights, there is monitors, there's a TV screen and there's this blue light which comes from there which also causes tanning and pigmentation. So you are using a physical sunscreen, you can go out immediately. If you're using a chemical sunscreen, you need to apply it 15 to 20 minutes before going out. These days, we do have physical sunscreens which do not leave a white cast and which is very acceptable. Any other sunscreen which is a cream formulation can be comedogenic or it can increase your acne because of occlusion. And do not use the spray on the face because the sunscreen then can go into the eye and cause irritation. Let us see why we need to use a sunscreen. Hello, I am Dr. Savitha, dermatologist from Bangalore. Today I will discuss about a very simple and effective tool in our skincare routine, which is a sunscreen. Whether you're 16 years of age or 60 years of age, whether you have oily skin or dry skin, whether you're indoor or outdoor, sunscreen is very important. Sunscreen is not an option for us. Sunscreen is almost like a mandatory use for us. Let us see why we need to use a sunscreen. We are all exposed to sun every day and sunlight gives us ultraviolet rays. Ultraviolet rays is UVA and UVB. Now this UVA rays goes into the skin and causes more of pigmentation, it causes early aging, it causes wrinkles, whereas UVB causes sunburns and rarely it causes skin cancer in Indians. Now most of us think sunscreen has to be used only during a vacation or when we are out in bright sunlight. This is not true. Even on a cloudy day, 80% of these ultraviolet rays penetrate the clouds and reaches. Even though you're inside, ultraviolet A rays can move and enter through glass. When we are inside, indoors, there is tube lights, there is monitors, there's a TV screen and there's this blue light which comes from there which also causes tanning and pigmentation. Because of all these factors, to protect our skin every day, we need to use a sunscreen. When you go to a shop to buy a sunscreen, there is such a big variety that we get confused what to buy. So, one sunscreen will not suit all of us. Meet your dermatologist, get your skin assessed so that they can help you choose the best sunscreen. You should select a sunscreen which you are comfortable wearing because you will be using it regularly, every day and lifelong. When we choose sunscreens, we have to see what is our skin type, what is our use for the sunscreen, how much of sunlight exposure we are doing, and what are the contents of the sunscreen. Though in social media we see various types or in shops we see various types of sunscreens, mainly sunscreens are of two types. One is a physical or a mineral sunscreen and the other is a chemical sunscreen. So this is the two broad classification or what the sunscreen contains. Physical sunscreen or mineral sunscreen contains zinc oxide or titanium dioxide which forms a coat or layering on the skin and reflects and scatters the sun rays. So the minute you apply the sunscreen, it is effective. Whereas a chemical sunscreen contains chemicals or organic compounds like avobenzone etc. which when applied on the skin has to penetrate a little or go into the skin and then start the effect. So it takes about 15 to 20 minutes for it to show the action. So you are using a physical sunscreen, you can go out immediately. If you're using a chemical sunscreen, you need to apply it 15 to 20 minutes before going out. But this physical sunscreen, though it is very safe, can be used in small children, can be used on sensitive skin, but sometimes causes a white cast which you may not be comfortable with. Now, these days we do have physical sunscreens which do not leave a white cast and which is very acceptable. Coming to the chemical sunscreens, these are very cosmetic. They do not give the white cast when we apply it on the skin. It looks good, but it's just that we cannot use it on a very sensitive skin. Slight chance of allergic reactions are there in few patients, and in very small children, babies, we cannot use a chemical sunscreen. Next, there's a term, what you see is broad spectrum sunscreen. So broad spectrum sunscreen means it blocks both ultraviolet A and ultraviolet B light. Next, most common word which you see associated with the sunscreen is SPF, which is sun protection factor. Now, what is the meaning of the sun protection factor? SPF means how much protection this sunscreen is giving us against UVB. The word SPF has no relation to UVA. It's only for UVB. So does that mean if you use a higher SPF, you have maximum protection? It is not like that. When you use a sunscreen which has a SPF of 15, that means it blocks 93% of UVB. So SPF 15 is already blocking 93%. You use a higher sunscreen, SPF 30. That will not block 100% or double, some 180 plus. A SPF 30 will block 97%. And a SPF 50 will block about 98.5%. So for our Indian skin, SPF 30 to SPF 50 is adequate. Other than that, sunscreen also has something called PA. So it comes as a plus. The more number of plus mentioned on your sunscreen means the more protection against UVA. Other than this, we do also have other sunscreens like tinted sunscreen. Now, what is this tinted sunscreen? Tinted sunscreen is a mixture of a physical sunscreen plus a coloring agent. Usually, it contains iron oxide, and the advantage is it also blocks visible light. So, when we have pigmentation, especially melasma, visible light also has a role, and tinted sunscreen has an advantage there. Because it has a slight color, it gives a uniform tone, and people who have some blemishes, instead of layering it up with cosmetics or foundation, they can use a tinted sunscreen. Now we have fluid sunscreens. These have a very thin texture. It will be like a serum. It's easy to apply, especially if you have oily skin or for your daily use. So you can use a fluid sunscreen. You also have a spray sunscreen. So when you need to apply on large body areas like the back or entire hands, you can use a spray. Now all these sunscreens may be just physical, chemical, or it can be a combination of both. Now the question comes, how soon can someone start using a sunscreen? Sunscreens are safe from the age of 6 months. So from 6 months to teenage, they can use a physical sunscreen. Teenagers can use a combination of physical and chemical sunscreen, and after that in adulthood, any of the sunscreen can be used. How much sunscreen should be used to get maximum benefit? Most of us do not use the adequate amount of sunscreen. To cover the face and neck, half teaspoon or 3 finger units of sunscreen has to be used. And similarly, you can calculate for the body, where 2 to 3 teaspoons of sunscreen will be required for the whole hands and back. How frequently should we reapply the sunscreen? All the sunscreens work well for 2 to 3 hours. So if you are out in sunlight, reapply the sunscreen every 3 hours. But if you are indoor and not going out, then once daily application is adequate. If you are into a lot of sporting activities where the sweating is more, the sunscreen, which are called water resistant sunscreens, are effective only for 40 minutes. So there a reapplication has to be done at every 40th minute. Now let's talk about water resistant sunscreen. A sunscreen which gives protection for 40 minutes is called a water resistant sunscreen. So if you are into sports where sweating is more, if you are into any water activities like swimming or water sports, the maximum protection a sunscreen can give is 40 minutes, and then the sunscreen has to be reapplied. Use about sunscreen in snow. Tanning does happen in snow because most of the sunlight gets reflected, and burn and tan is maximum in snow than in land. So when you're in a place where there is snow, though it is very cold and at -0 degrees Celsius, make sure you use a good sunscreen, especially a physical sunscreen, for maximum benefit. One myth about using sunscreen is regular use of sunscreen causes vitamin D deficiency. This is not so. Sunscreen will not prevent the complete effect of sunlight or vitamin D production. So there is no vitamin D deficiency which happens because of sunscreen use. How do you choose the right sunscreen for you? The best way is to consult a dermatologist who will examine your skin and who will suggest the sunscreen. I would like to give a few tips. If you have a very oily skin or acne prone skin, use a physical sunscreen or use a silicone based sunscreen which will have a matte finish. You can even use a gel based sunscreen or a fluid sunscreen. Any other sunscreen which is a cream formulation can be comedogenic or it can increase your acne because of occlusion. If you have a very dry skin, then go for a cream based sunscreen which will also have some moisturizing effect. If you have slightly dark skin or have pigmentation issues like melasma, you can go for a tinted sunscreen so that there is some color match also which is happening and it will act like a makeup base. If you want for normal use and use it very frequently and don't like anything thick on your skin, then you can go for a fluid sunscreen. For the whole body or when you're near the beach, you can use a spray sunscreen for ease of application. But when you spray, you need to spread it out also, and do not use the spray on the face because the sunscreen then can go into the eye and cause irritation. In spite of using adequate amount of sunscreen, the right type of sunscreen and frequently applying the sunscreen, all of this will give us only about 40% protection against sun rays. For complete protection, always we need a physical covering. So when you're going out, use a hat which is a wide rimmed hat or use an umbrella. You can cover your hands with a thick clothing, not a transparent see-through one. This will ensure that you have maximum protection against sunlight.